I think the first priority for the Australian Society of Plastic Surgeons at the moment is continuing the really important work that we're doing to do with patient safety and the safety of the community as a whole. Aesthetic surgery is the most obvious area, but I think all areas of plastic surgery, we're absolutely committed to patient safety. And I think that involves a couple of projects that have been really a 5 or 6 year project for ASPS. So one of them is the titling of surgeons. So we believe that only doctors who have had full and thorough surgical training and understand how to manage the risks and complications of surgery should be able to call themselves surgeons. And secondly is we've been assisting APRA in the development of guidelines for aesthetic surgery or cosmetic surgery. And we work very closely with the Department of Health in developing Medicare item numbers and ensuring safety using those items. To the lay people, it's very confusing what's a plastic surgeon compared to a cosmetic surgeon, and aren't they kind of the same thing? But really it's to do with that groundwork in training. The 5-year training program for plastic surgery is so rigorous and so thorough and covers not only every surgical procedure, but it covers communicating with patients. It covers looking after them after their surgery and ensuring that we're able to recognise complications. But it's not even just that. It's the 2 or 3 years before you can even get on to the plastic surgery training, where there are criteria that you have to meet. So you have to have done the course of the Royal Australasian College of Surgeons for the critically ill patients. You have to have done a term in ED or intensive care. And so those really strict prerequisites are why we end up with such fantastic surgical trainees in plastic surgery, and why we feel that we really do have the ability to deliver much safer care to those patients. The technical side of plastic surgery is really complex, but it's not just about that. It's a little bit like the difference between somebody who can ride a bike around a schoolyard who's a bit wobbly and somebody who can ride a bike home through peak hour traffic in central Sydney. And you know in your head that it's a completely different thing. And it's not just about the mechanics, it's about those looking out for dangers and understanding how to manage risks, which we have really well drilled into us.